Assalamu alaikum. Welcome to my channel Pharmacology Made Easy. Today we'll discuss about the classification of antiemetics. At first, 5-hydroxytryptamine 3 receptor blocker. 5-hydroxytryptamine 3 receptor blockers are ondansetron, granisetron, dolasetron, palonosetron. The second one is another blocker, that is dopaminergic 2 receptor blocker. Sometimes we called it prokinetic agent because they increase the gastroesophageal peristalsis and increase the gastric emptying. That's why it increase the emptying of the stomach so fast. So by through this mechanism, it increase the lower esophageal sphincter pressure and ultimately increase the intragastric pressure and leads the food disturbs towards the small intestine. So that's why sometimes we called it prokinetic agent. Another thing we should tell about this drug, that in case of diarrhea, never used prokinetic agent. Sometimes acute gastroenteritis, we know one of the cause of vomiting is acute gastroenteritis, and in acute gastroenteritis there will be fever, diarrhea with vomiting. If there is vomiting and if any physician use prokinetic agent in this type of vomiting, the diarrhea will be 100% aggravate because domperidone increase the gastric peristalsis and also increase the esophageal peristalsis and ultimately increase the gastric emptying so fast. So that's why this peristalsis causes more diarrhea and more dehydration for this patient. So do not use this kind of drug in diarrhea patient. Okay. The third one is neurokinin receptor antagonist. Neurokinin is nowadays these drugs are used in cancer, chemotherapy induced nausea, vomiting, and it's a good choice of drug. It is a newer drug and that is aprepitant, that is natopitant and rolapitant. Sometimes corticosteroids have role in prevention of vomiting, that is we used the long-acting dexamethasone and methylprednisolone. Antihistamine has role in prevention of nausea, vomiting because the histaminergic receptor are present in the chemoreceptor trigger zone and also in the vomiting center. It is also present in the vestibular system. So these antihistamines are, we use the first generation antihistamine, that is diphenhydramine, diamine hydronate, cyclizine and meclizine. This cyclizine and meclizine mainly used in morning sickness. So these two drugs are the choice of drugs in case of morning sickness, and this diphenhydramine and diamine hydronate are mainly used in the hyperemesis gravidarum patient, and sometimes it is given injectable to prevent the vomiting of this hyperemesis gravidarum. Another antimuscarinic drug we used in the motion sickness. The drug is hyoscine or scopolamine. These drugs are used to prevention of motion sickness, and this motion sickness occurs in traveling to any side by road, bus or train or aeroplane. We can feel the sickness, and the sickness is associated with vomiting, vertigo. So this antimuscarinic can prevent this motion sickness. So we can use hyoscine or scopolamine in case of motion sickness. Sometimes benzodiazepine and lorazepam and diazepam are also used in prevention of vomiting, and these drugs are mainly used in prevention of anticipatory vomiting. The patient, these drugs causes anterogate amnesia, and that's why the patient forget the feel of vomiting. So not only in anticipatory vomiting diazepam used, it's a combination of drug we used, and the combination is mainly ondansetron or granisetron with neurokinin 1 receptor antagonist, that is aprepitant, with lorazepam. The combination is prevention of anticipatory vomiting is a combination of three drugs. Not only one drug can prevent the anticipatory vomiting. In anticipatory vomiting, the role of benzodiazepine is to produce forgetfulness or or forget the feeling of vomiting, because it produce enterogate amnesia to this patient by taking this lorazepam. Another antipsychotic drugs we can sometimes use in case of prevention of chemotherapy induced nausea vomiting, that is olanzapine, clonazepam, sometimes haloperidol or droperidol used, but these drugs have most side effect, and these drugs are so dangerous to be used. One kind of drug that is new in prevention of nausea vomiting, these are the new drug, that is cannabinoid, and these are dronabinol and nevinol. So thank you all to give patience about listening the classification of antiemetics. Hope this video will helpful to memorize or to realize or to understand the antiemetics classification so easily. So thank you all, and thank you for watching this video. In the next video we'll discuss about the 5-HT receptor blocker. Then part one by one we discuss all the drugs. So thank you again.